Hello and welcome. My name is Christopher Hole from christopherhole.com, and welcome to this video. We are going to be talking about low back pain and sciatica. So hopefully you can see on the screen we've got the right leg. You can see the back of it, the pelvis, and we've got the sciatic nerve here, sort of running all the way down the back of the leg, and then it branches off into various other nerves, and it makes its way all the way down to the heel. So if you do suffer with sciatica, you might have experienced that shooting pain down the leg or certain pain in certain different parts of the leg. But what we can also have with low back pain as well is a similar sort of scenario. It's not a traumatic pain. So if someone hits you, that's what I would describe as like a traumatic pain. Now, low back pain can be sort of a traumatic. It could be in a car crash or whatever, you fall awkwardly, and that puts your back out, and then you have low back pain. But another part of low back pain is what is known as neurogenic pain, and the reason I'm going to talk about this, and the reason I'm bringing the sciatica into it, is because the nerve plays such a big role in low back pain and in sciatica. And all neurogenic pain it's a pain caused by a lesion or dysfunction in the peripheral nervous system. And as you can see here, this is what we're looking at, the peripheral nervous system, so a nerve coming out of the spinal cord, and it being the sciatic nerve, obviously for sciatica. Now, there's some symptoms that come from this dysfunction in the nerve, and obviously one of them, because we're talking about it, is sciatica, but another one is tight hamstrings. So what most people do is they'll do like a stretching program for either sciatica or for tight hamstrings or for even low back pain. They'll try and stretch out their back, or they'll try and stretch out the areas around their back, their hips, their legs, to try and release some of the tension in and around that painful area. But in his book Low Back Disorder, by Dr. Stuart McGill, he says this stretching or stretching program only gives a short-term effect, which will last roughly about 20 minutes. Because when you're stretching, what you're doing is you're relaxing the muscle. You're not necessarily relaxing the nerve that feeds the muscle. So what we need to be able to do is we need to be able to, in a sense, relax and bring less tension to the nerve. Because in sciatica, the nerve is under excessive tension. When we move, the nerve has to get longer and shorter. So if you can imagine this leg walking, if it was to lift its knee and move forward, it's going to, in a sense, need to or stretch the nerve to be able to compensate for the extra distance that the nerve has to travel from point A to point B, if that makes sense. So basically, as we move, the nerve is getting longer and shorter. And if we've got it under that excessive tension, it's not going to be able to move or make itself longer and then shorter. Hence, we then get some degree of pain. So if for whatever reason the nerve is affected and it cannot make itself longer and shorter, then the nerve becomes, in a sense, stretched. Now, this is when we can experience the different types of neurogenic pain, so the shooting down the legs and the low back pain and things like that. So what we have to do is we have to introduce something called neural mobilization, because what this is doing, this is allowing the nerve to get longer and shorter, and in a sense it's stretching the nerve, but in a safer way than stretching itself, if that makes sense. Because what we're looking to do is to pull the nerve safely from or between point A and point B. So it's like sliding a piece of string from point A to point B. You're not trying to stretch the nerve apart, you're just trying to get it to slide between point A and point B. So when you pull point A away from point B sort of comes with it, if that makes sense. I know I obviously haven't got a picture on the screen, but I'm hoping that sort of verbal example will start to make some degree of sense. So that's what neural mobilization, or what is known as flossing, is doing, and this is sort of the basis of this movement. And if you're on the blog, I've put a short video just like an example of nerve flossing and a good nerve flossing exercise or technique that can be done for low back pain and especially sciatica. And what we have to understand as well, and I'll leave the video here, is while flossing can be useful, too much too soon can bring sort of the acute pain on. So what we've got to be able to do is we've got to start conservatively, so don't do too much. Just start doing maybe a few reps of nerve flossing and then just leave it. If you don't get any sort of feedback in pain, then maybe continue it the next day or even the day after that. Okay, so just remember to start conservatively and progress slowly. If you at all ever feel any degree of pain, stop. Okay, so I hope this video has been helpful. Again, if you're on the blog, christopherhole.com, just go to the video underneath, and that's an example of something that you can do straight away to start flossing the nerve and sliding it from point A to point B to relieve some of the tension in the nerve to hopefully relieve any low back pain or sciatica that you might be experiencing. Okay, many thanks for watching. My name is Christopher Hole from christopherhole.com. I will speak to you in another video.